In the last video, we were studied about development and growth of the mandible, that is embryology. In this video, we will going to learn about the mandible. Friends, this video content is taken from respective books of medical and dental anatomy, so you can make notes from this video. It's 100% correct for examination purpose. The mandible is the largest, strongest, and lowest bone in the face. It has horizontally curved body that is convex forward and two broad rami that ascends posteriorly. The body of the mandible supports the mandibular teeth within the alveolar process. The rami bears the coronoid and condyloid process. Each condyle articulates with adjacent temporal bone at temporomandibular joint. The body of the mandible. Each half of the body has outer and inner surfaces, the upper and lower borders. The two surfaces presents the following features. Symphysis menti is the line at which the right and left halves of the bone meet each other. It is marked by a faint ridge. In this picture, we can easily see the faint ridge which adjoining the two halves of the mandibular bone and forms the body. Mental foramen is seen, mental protuberance is seen, mental tubercle is also seen. The mental protuberance, mentum means chin, is a median triangular projecting area in the lower part of the midline. The inferolateral angles of the protuberance forms the mental tubercles, two mental tubercles. The mental foramen lies below the interval between the premolar teeth. In this picture, the side of the body is seen having mental foramen, mental protuberance, body, angle, ramus, condyloid process, coronoid process, mandibular notch, pterygoid fossa. The oblique line is the continuation of sharp anterior border of the ramus of the mandible. It runs downward forward towards the mental tubercle. The incisive fossa is a depression that lies just below the incisor teeth. In this picture, the oblique line is seen, the incisive fossa is seen, mental foramen, base, oblique line, angle, ramus, neck, alveolar border, alveolar process bearing the upper teeth. The inner surface presents the following feature. First, Myelohead line is a prominent ridge that runs obliquely downward and forward from below the third molar tooth to the median area below the genial tubercles or genial spine. In this picture, in the center we can see the genial tubercles, also known as genial spine, the Myelohead line, and the inner side of the body, the sublingual fossa, submandibular fossa, and the digastric fossa is also seen. B. Below the Myelohead line, the surface is slightly hollowed out to form the sublingual fossa, which lodges the submandibular gland. Above the Myelohead line, there is sublingual fossa in which the sublingual gland lies. So, below and lower to below and the and lower to the Myelohead line, two glands are present. Upper to the Myelohead line, sublingual fossa is there, and below submandibular fossa is there. The posterior surface of the symphysis menti is marked by four small elevations called superior and inferior genial tubercles. The Myelohead groove present on the ramus extend on the body below the posterior end of the Myelohead line. The upper alveolar border bears the socket for the teeth. The lower border of the mandible is also called base, which is rounded. Near the midline, the base shows oval depression called digastric fossa, which give origin to the digastric anterior belly of digastric muscle. Ramus. The ramus is quadrilateral in shape and has two surfaces, that is lateral and medial, two borders, upper, lower, anterior and posterior. Two processes, coronoid and condyloid process. The lateral surface is flattened and bears a number of oblique ridges which give insertion to the masseter muscle, is a masticatory muscle. So in this picture we can see the flattened area which bears oblique ridges for the masseter muscle. The ramus is seen. The medial surface of the ramus presents the following. The mandibular foramen lies a little above from the center of the ramus at the level of occlusal surface of the teeth. It leads into the mandibular canal, which descend into the body of the mandible and opens at the mental foramen and transmit mental nerves and vessels. Second, the anterior margin of the mandibular foramen is marked by a sharp, bony, sharp tongue-like projecting area, tongue-shaped projecting area called lingula. The lingula is directed towards the head or condyloid process of the mandible. Third, Myelohead groove begins just below the mandibular foramen and runs downward and forward to be gradually lost over the submandibular fossa. The upper border of the ramus is thin and is curved downward, forming the mandibular notch. The lower border is backward continuation of the base of the mandible. Posteriorly, it ends by becoming continuous with the posterior border at the angle of the mandible. The anterior border is thin while the posterior border is thick. Two processes. First, the coronoid process. It developed from Greek word that crow's beak, meaning is crow's beak. It is a flattened triangular upward projection from the anterior superior part of the ramus. Its anterior border is continuous with the anterior border of the ramus. The posterior border bounds with the mandibular notch. The condyloid process is a knuckle-like process. Is strong upward projection from the posterior superior part of the ramus. Its upper end is expanded from side to side to form the head. The head is covered by fibrocartilage and articulates with the temporal bone to form the temporomandibular joint. The constriction below the head is neck and anterior surface present depression called pterygoid fovea